It was the Lourdes Hospital inquiry really was the big spur, and that showed significant safety failures for patients. But we know that it's not alone in Ireland. International literature shows that as many as 1 in 10 patients who are admitted to hospital can have an adverse event as a result. So it's an international trend now to try and address this problem. Well, we know in Ireland there have been significant and high-profile cases where diagnosis has been missed or too late. People have suffered, not had their illnesses sorted out in time. There have been cases where surgery has gone wrong. People have had terrible consequences to that. We also know they're not alone. There are other failures throughout the system. So the Patient Safety Initiative is really the first real system-wide attempt to try and address this using international standards to bring into Ireland things like checklists, things like reporting, things like reviewing cases, things like changing the culture that will mean that we're going to really turn this around. Well, we're going to introduce accountability into the system, so people are going to know exactly whose job is what. We'll also be using standards across the system so that things should be done the same way, to the same high standard in all circumstances. And to see that that's happening, we're going to use audit to review exactly, to ensure that the standards are being applied. IT is going to be important in this because IT gives us the information to know what's going on in the system. But even more importantly, the whole team, including the patient, is going to be working together on this. That's vital because it's patients that will really change the culture.